Ugh, so your eyes are watering, your nose is running, you feel miserable, and you don't know what to do. Have no fear. I am here. I am a licensed pharmacist in 3 states, and I put together the ultimate guide for allergies. Anyone who's experiencing allergies must watch this video and they will know everything they need to know to treat themselves or someone that they love. I'm Grant Harding. I'm a licensed pharmacist in 3 states and a medication pricing expert. First of all, what is an allergy? A lot of people don't even know this. So an allergy is an IgE mediated response. Now what the heck does that mean? IgE is a long strain of protein that your body uses and it tangles it up and it makes something called an antibody. IgE is an antibody. Whenever your body inhales or is exposed to an allergen, IgE will attach to it and then start the inflammatory response. This occurs naturally for good reason. Think about it. Like if something goes up your nose that shouldn't be there, you'll sneeze or your nose will be runny because your body is trying to get it out. But sometimes it overreacts, and that's a bad thing. We don't want that to happen. So how do you treat that? How do you navigate that unfortunate situation? So what actually happens is if something flies up your nose, an allergen, something that shouldn't be there, it attaches to IgE on the cells in your nasal wall. Once this thing is activated, it starts off a huge cascade of events. It involves releasing things like histamine, cytokines, and chemokines. So we either have to stop that process or counteract it with something else. First thing we need to do is get rid of the thing that's causing an allergy. For most people, that's pets. So I'll just move on to step 2. A lot of people want to reach for the nasal sprays first, and that's a good choice. So the steroid nasal sprays is recommended first. A steroid, whenever inhaled nasally, turns off that response, the cytokine response. But because of this mechanism of action, it may take up to a week before you can say that it's not working. In other words, you may not see results for about a week. Now, where people get really confused is they don't know which one to use. And the official statement is there are no significant differences in efficacy between the available agents. But what if your eyes are also watering? You know, those two things happen pretty frequently together. Thankfully for you, along with diminished nasal symptoms, inhaled nasal steroids have beneficial effects on allergic eye symptoms, including itching, tearing, redness, and puffiness. These are all coming from the official guidelines. The nasal steroid sprays are overall tolerated very well. The most common side effect of inhaled nasal steroids are result of local irritation, including dryness, burning, stinging, blood-tinged secretions, and epistaxis. Epistaxis is just another word for nosebleeds. Here you can see a chart from the guidelines, and it talks about the different nasal steroids. Again, we don't care which one you use. And also, take a note on the right row here, OTC or prescription, ignore that. This guideline is from, I think, it was before 2020. Like it was a long time ago. It hasn't been updated in a very long time. A lot of these are over the counter now. I know for a fact mometasone is over the counter. Triamcinolone is, oh wait, it's listed as over the counter there. Fluticasone furoate is over the counter now. For me, just to give you an answer, as my professional opinion, I'm going to tell you to pick whichever one's cheaper. A lot of people don't like that answer, so I will say this. Fluticasone propionate. That is the one I would recommend. It really doesn't matter which one you get, though. Here you can see a bottle of fluticasone from Walmart. This is at the filming of this video. It's about $10. Okay, that's not bad. You know, you probably should use this once or twice a year. Second part. You got your nasal steroid. We're feeling good. But what about blocking that histamine release? Well, we can do that too. So we also want to use an antihistamine, and they can be used in conjunction with a nasal steroid or on its own. Let's talk about it. Like we said before, whenever that non-wanted allergen, that molecule that we hate so much, whenever it binds into your nostril hairs, it's not your hairs, it's your cells in your nose, it also starts off this event that releases histamine. In this case, we don't like histamine. We want to block it. So we can do that. There are 2 types of antihistamines. There's first generation and second generation. First generations are things like Benadryl. The active ingredient is diphenhydramine. Doxylamine which is the active ingredient in Unisom. Those are all first generation. Second generation are things like Zyrtec, the active ingredient is cetirizine, Xyzal, which is levocetirizine, and Claritin, which is loratadine, is the active ingredient. First generations we have to talk about because although they do block histamine, they're also anticholinergic. And I don't even like calling them antihistamines really because they're just as much anticholinergic, meaning that they block acetylcholine as much as they block histamine, pretty much. The first generations cross the blood-brain barrier, and that's where they can exert their effect. Because of this, it does cause drowsiness and sedation. Now, is this good or bad? It depends on who you ask, and it depends on what you want to do. If you're trying to go to bed, I mean, it's arguably a good thing then. But if you're going to go drive heavy machinery and operate large automobiles, I'm just imagining a guy taking Benadryl and then operating what's that thing? Like a jackknife? Is that the thing that you use to break up concrete or whatever? I don't know construction things. Do I look like I know construction things? I actually used to work in construction, but I forgot the things, what they're called. People often like to ask me about first generation antihistamines and the link with dementia. Anything that has an anticholinergic effect would put somebody at risk for dementia, right? Because if you think about it, this is the exact opposite of the treatment we use to treat dementia. It would stand to reason that blocking acetylcholine may increase someone's risk for dementia. I personally don't think using a first generation antihistamine every once in a while is going to harm anyone. I feel very comfortable doing it myself, and I would recommend that for anyone that I loved. But not only is it probably not a good idea to use a first generation long term, it actually doesn't even make sense to do that because our second generations last all day, where our first generation even takes several times during the day. One thing that kind of pulls me back to the first generations is that anticholinergic side effect is going to cause a dryness effect, especially in the nose. It will inhibit secretions. That's one of the hallmark symptoms of blocking acetylcholine. So for short-term runny nose, that's when I would recommend using a first-generation antihistamine. Although you probably should just forget the class altogether, honestly. That's what the guidelines recommend anyway. In fact, the guidelines don't even mention the first generations at all. Here's a chart of the second-generation antihistamines from the guidelines. And as you can see here, again, this is very old. Xyzal is now available over the counter. You don't need a prescription for Xyzal anymore. And this is what the guidelines have to say about the selection of an antihistamine. There are relatively few comparative studies among the various compounds of second-generation antihistamines, but data indicate that cetirizine and its active enantiomer levocetirizine are the most potent but carry a modest risk of sedation not seen with other drugs in the class. Cost-wise, cetirizine is more than likely going to be the cheapest option. I'm going to say just pick whichever antihistamine is the cheapest in whatever store you're standing in. And if you're looking for long-term use, definitely use a second-generation antihistamine. I will say cetirizine. That's the one I'm going to recommend here today. Don't get fooled by levocetirizine being the active enantiomer. I know it sounds nice, but this is very common. We have like mixed combinations of the inactive ingredient or the inactive enantiomer and the active enantiomer, which is basically how the molecules are folded in space. The body uses the active ones, and the inactive ones just kind of get deleted out the body. And then we also have preparations that only have the pure active form. And logic would make you think, oh, I should take the pure active form one. For whatever reason, it doesn't seem like there's ever a difference between the two. This is not the only time that you'll see this. Some of our medications to treat GERD, they also have these combinations, and for whatever reason, it just doesn't seem like it really matters. So that's why I picked cetirizine for this recommendation. Here you can see cetirizine from the Dollar Tree, $1.25 for 14 10-milligram tablets. That's very good. It does come in a 5 milligram, I think, but that's for the kiddos. You typically want a 10 milligram tablet. Levocetirizine from Walmart. This is the 5 milligram. Remember, this is the active form. That's why the dose is half. And that's about $6. but you're paying a lot more for the levocetirizine. Additionally, good recommendation here at Walmart, loratadine 10 milligram is about $4. The astute learner would notice I skipped on something, but not really. It's coming up right now. There's another class of nasal sprays that we didn't talk about. There's actually two more. But the antihistamines come in a nasal spray as well. Now, where do those fall into therapy? Here we can take a look at a chart, and we see olopatadine, azilistine, and that's basically it. Azilistine is the only one you need to worry about. And this is what the guidelines have to say about this. For the treatment of nasal symptoms, intranasal antihistamines have shown equally or superior efficacy to oral antihistamines in numerous well-designed, randomized, controlled, and blinded studies. So good, the nasal antihistamines are just as good as the oral. The most common adverse events related to intranasal antihistamines are bitter taste, interesting, epistaxis, headache, somnolence, and nasal burning. So then, if your symptoms are mostly in your nose, you can also use a nasal antihistamine. I typically don't recommend these, but it's because they're just kind of hard to find, and whenever you do find them, they're really expensive. So, for example, there's Astepro, and this actually really wasn't that expensive at CVS, believe it or not. It was only $9. But for the most part, you're going to pay, I think it's like $20 at pretty much every other pharmacy, and it doesn't have a generic version. I don't really know why. We talked about a couple different classes here. Which ones can you use together? If there's no response to inhaled nasal steroids or incomplete control of nasal symptoms with an inhaled nasal steroids, oral antihistamines should not routinely be used as additive therapy. So if you're using fluticasone nasal spray, or Flonase is the brand name, they do not recommend adding an oral tablet such as Claritin or whatever. Oral antihistamines and oral decongestant combination control symptoms better than either oral antihistamines or oral decongestants alone. Decongestant in this instance, we're going to call Sudafed, pretty much. Adding an oral decongestant to a second-generation antihistamine increases side effects of insomnia, headache, dry mouth, and nervousness. Yes, if you go to the pharmacy and you buy Sudafed, 9 times out of 10, they're probably going to hand you something that also has an antihistamine in it. So they're saying that that combination is good, but it does lead to more side effects. But here's where things get weird. The guidelines do say that using inhaled nasal steroid and an inhaled antihistamine through the nose is effective. The combination of an inhaled nasal steroid and a nasal antihistamine is more effective than either by themselves. Interesting. So you can put two things in your nose, but you can't put a thing in your nose and your mouth. That's what I took from that. And here we can see a chart that sort of goes through all of that. Don't worry about leukotriene receptor. That's something you need a prescription for, and we're not going to talk about that today. Folks want to know about herbal remedies for allergies. Well, unfortunately, it's exactly what you thought. You can take a look at this here. The guideline development panel was unable to make a recommendation on the use of herbal therapy for treating patients with AR. But there's a third nasal spray that no one ever talks about. It's called Cromulin. It's not a steroid and it's not an antihistamine. It comes in the brand name called Nasal Crom. I'm not really sure what to do with this one because the guidelines don't mention it. Everything I'm seeing about it seems like it's pretty good for preventing allergies, but it's really tough for me to make an opinion, honestly. Availability of this one is pretty odd, and I mean, if you buy it online, it's gonna be like $20. And there's a generic that exists, but it's still very expensive, and it's kind of hard to find. So I don't think many people consider this at all. Maybe I'd do it if like everything else seemed to have failed. That's probably where I'd reach. We talked a lot about a runny nose here today. What about a stuffy nose? First thing to note with a stuffy nose is that it could be viral or bacterial, in which case you need those infections treated, which can only be determined by a doctor. But if it is due to some sort of allergic response, there are lots of options for a stuffy nose. If it is allergic, the GOAT is Sudafed. Not to be confused with Sudafed PE. Sudafed PE is Junco garbanzo beans trash and will be taken off the market here soon, more than likely. Sudafed is goated AF. Sudafed, well, actually, they're both alpha agonists, but Sudafed's the only one that actually does anything. And it causes vasoconstriction in the nose, and it really helps with congestion. Because of that mechanism of action, it can actually cause increases in blood pressure, although the clinical significance is iffy on that. And it also causes issues with prostate, so you have to be aware of those. There are some nasal sprays for congestion, and the GOAT there is Afrin. In fact, Afrin is so goated that you can only use it for 3 days, and I've never actually even used Afrin because I'm kind of afraid. I'm not kidding. I'm afraid to use Afrin. I'm a little baby. The Dollar Tree version of Afrin is only $1.25. If you want to use it, that's where I would get it. Benzodrex, the old Benzie. Don't have it with me here today, but I've reviewed this before. Goated AF. It's a little stick that you kind of shove up in your nostrils, and it works wonders. Unfortunately, Benzodrex also has a warning from the FDA due to potentially habit-forming tendencies. One little Benzodrex stick is going to be like, I don't know, $5 to $10, something like that. That's pretty good. Neosynephrine is intranasal phenylephrine. So remember, phenylephrine taken by mouth is Junko Garbanzo Beans trash balls. But using it as an intranasal inhaler is still effective. So the brand name for this is Neosynephrine. And it's about $5 at Walgreens. That's not bad. I've never used this, and I don't really want to. But I wouldn't be upset at all if someone I loved used it. I think it's a fine alternative. Don't be afraid to take just a normal saline nasal spray. It's non-medication. It's literally just salt water. And they sell them for $1.25 at Dollar Tree. And you can just, clean out your nostril as well. That helps a lot. Just physical getting that gunk out helps more than what people know. For a rash, from an allergic reaction, I would use just hydrocortisone cream. 1% is what you're going to find over the counter. This was from Dollar Tree, and I can assure you it's perfectly fine. This is what I would recommend for a topical rash. If it wasn't obvious, that's $1.25 for that tube. Topical Benadryl, I do not recommend. This is a topical diphenhydramine. Although that sounds great, and it sounds lovely, I keep my histamine receptors on the inside of my body. I don't know where you keep yours. The diphenhydramine molecule will not penetrate the skin to any meaningful extent, and it has to for this particular mechanism of action to get past the skin. So it sounds cute and nice, and people will tell me that they use it and it works, but they're wrong. I do want to make a quick comment. Every once in a while, you can get a cough from an allergic reaction. And this happened to me several years ago, and it was to the point where I was staying up all night and I couldn't function. Like I literally couldn't go to work. And don't be afraid to try, especially a first-generation antihistamine, just as a trial to see if it helps with a cough. So I do want to make that one comment there. For the eye watering and the eye redness, you might as well just throw a dart at a board because there's so many products. Nobody seems to really know what the difference between a lot of these are, and it really probably doesn't matter. The guidelines don't even mention this. I'll just give you my personal and professional recommendation, which is something called ketotifen. And this is an antihistamine that you can use in your eyeball. If you want something even more strong, there's something called Nafcon A. You'll probably have to special order this. I don't think I see pharmacies carry this very often. But Nafcon A is a vasoconstrictor and an antihistamine. So you got two different chemicals working there helping you out. And Nafcon A is about $11 at Walmart or Amazon. But you'll probably have to order that one. I'd recommend staying away from olopatadine. That's an eye drop. And the reason being is not because it's bad or dangerous. It's because there's several different types, and it's very confusing, and it's honestly not worth the time to understand. And there's one product that's a little bit scammy, honestly. The one olopatadine product is like very crazy expensive for no reason. So I would just stay away from it just for that reason. For any prescribers watching this, eye drops in general are quite scammy. There's a lot of scam eye drops out there, and I think I know why. I think the people who prescribe them are a little bit of an easy target for these companies, I think. But just in general, I'd say be on your toes whenever you prescribe an eye drop. All right, folks, thank you so much for joining me here today. This was a lovely presentation. I hope I answered all your questions. Leave some questions in the comments. I want to make like my more educational videos. I want to be more interactive with you folks. So if you have a question, leave it in the comment. I'm going to answer them and probably put them in the description as well, all the good ones. Stick around. I make tons of videos about medicines and lots of fun things. So I'd love to have you guys here.